This comes as more cases have been suspected in the global outbreak of this very rare disease. The World Health Organization, or the WHO, has identified 200 cases in 12 Western countries. So here's what we know about the 6 people the CDC is monitoring in the United States. There's 6 of them. They were passengers who sat near an infected traveler who had symptoms while on a flight from Nigeria to the UK earlier this month. Separately, CDC officials are also investigating a case of monkeypox confirmed in a man in Massachusetts who had recently traveled to Canada. And joining us now to get more perspective on this, Dr. Vanessa Walker. Dr. Walker, thanks for joining us. But first, I got to ask. So these 6 people were infected because they were sitting near the person who was infected on a plane.
Well, remember, they're being investigated, right? So it's not 100% that they are confirmed. So it will take time to see if they actually do have the virus. But when you're sitting next to somebody on a plane, you're in pretty close proximity. But this isn't like COVID. The large droplets that are created or that are required to spread this virus is different than COVID. You have to be very close to these people. And in fact, the more likely risk factor is going to be direct contact with infected, either the pox themselves, the various blisters, or with clothing that the person was wearing. So this is a much more high contact illness, not something that you're going to just walk by somebody and get from them breathing.
Well, and yes, they're investigating, but these were 6 infected people that were on this plane. And so I guess it's just a little confusing because at first, Dr. Walker, we heard that, it had to be really, really, really close proximity for a long, long, long time, right? And so you're, unless you're like laying down with the person or, in the same, using the same sheets, et cetera, sitting on the same couch, that sort of thing. But now, this is 6 different people. How close could 6 people be to one person? You've got the person on your right, the person on your left, but I don't know. I think that's why people are getting a little worried about this.
Well, that was a long flight, right? Anytime you're on an airplane, especially if you're back, in regular coach seating, those flights are packed and you are around people for many, many hours and, breathing the same air. And we're not really wearing masks on planes as much as we were before. So I could definitely see how that close environment could potentially lead to, a spread of this infection.
Do you have
I by no means am thinking that we in the general population here need to be terrified that we're going to get monkeypox right now.
But so does it spread through touching an actual sore? Or let's say that person with the open sore sat on a seat and then you sat on the seat? Or rubbed against a seat? It's contact with anything that other person was in contact with where the infectious material would touch it. So if you sat on a seat and then they left some infectious material behind and then you came into contact with that seat, that is another potential source. But remember, airplanes, they clean the seats in between now, especially with COVID. They have much higher cleaning than they used to. But like I said, the main source of infection of this virus is going to be direct contact with people, close contact. And like I said, I really don't want people to be afraid that they're going to get this virus going about their everyday lives. Do we need, so when do people get a smallpox vaccination? And who should, I can't remember if I've had one, frankly. I was born in 1976. Did I get one back then? I don't remember.
It was eradicated worldwide in 1980. So I was born in 1982 and I did not get a smallpox vaccine. So many of us alive right now have never been vaccinated against smallpox. And so it is something that obviously is a concern. Younger people, immunocompromised people, children are at highest risk of severe disease. But even so, this is a much milder illness than smallpox. This is not smallpox. It's in the general family, but it is much more mild. And the strains that we're seeing coming out, at least from the UK, are more on the less concerning death rate, looking at around a 1% versus the monkeypox can be upwards of 10% fatality rate in certain strains. So, yes, it's something to keep an eye on. But like I've said, this is something that we just need to kind of keep cool heads about it and let's not get too concerned.
Should we consider getting a smallpox vaccination? Are you going to get one for yourself?
No, I'm not getting a smallpox vaccination. I would wait until more information comes out from public health officials based on the concern. The contact tracing for this is going to be much easier than contact tracing for COVID, let's say. They're going to be able to, I think, get this, this virus under much better care. I mean, think about Ebola. When we had patients coming in with Ebola, we were able to lock that down very tightly. So a really easily spread respiratory illness that has no symptoms, that's how COVID spread so quickly. And I think that's what we're all kind of latching onto. This virus is very different, and contact tracing and all the normal things that people do for public health are going to work very well to curb the spread of this virus.
All right. Well, thank you for all of that good information for calming fears people may have. It all changed in about 24 hours, what they were saying.
I know.
They're like, very unlikely. Now, we may be in Sacramento County. I mean, it was 24 hours. And so that's why, obviously you can understand why people.
Well, I'm somebody who traveled from an area that, had it. So it's.
All right. Well, we appreciate your time once again, and especially you've helped us so much over the last 3 years in the pandemic. Dr. Walker, thank you.
All right. Bye-bye.
Well,